Assalamu alaikum. This article talks about altered prevalence of Pulp diagnosis in diabetes mellitus patient, a retrospective study done by Yandy, Gonzalez, Marrero in 2022 in New Jersey and the Rutgers University. In the beginning, Introvinjad and his group project that the animal models have shown that interference of diabetes mellitus in the pulp healing process by inhibiting the dentine bridge formation and increase pulp inflammation after exposed pulp were addressed with the MTA. And also, diabetes mellitus have been shown to alter the expression of inflammatory mediator and modify structural component of the pulp. So the objective of this present study was to examine the prevalence of pulp diagnosis in diabetic patient compared non-diabetic patient. And the non-diabetic patient is a control group, and this project they focus on the prevalences changes of symptomatic irreversible pulpitis and pulp necrosis found in diabetic patient. In this project, the prevalence of different diagnoses include symptomatic and asymptomatic irreversible pulpitis, reversible pulpitis, and normal pulp necrosis was calculated from Axiom Electronic Health Record at Rutgers School between 2013 up to 2018, and they looking for procedure codes that indicate the initial and identical procedure. So the patient with this code they involved in this project, and the pulp diagnosis was identified from the chart note, and only patient with age between 20 to 69 years old at the time of the service were included. After identifying the patients, they categorize into 6 groups. So from the first group to the third group, all the patients are healthy, but with a different range of age. So in the first group is between 20 and 39 years old. The second group is between 40 and 59 years old, and third group is more than 60 years. While from 4 to 6 group is the diabetic patient with the same range of years. In the results, so they find 2,979 teeth with a clear diagnostic information. They found in this study that the prevalence of symptomatic irreversible pulpitis in diabetic patients younger than 40 years old was significantly higher than the non-diabetic control group, where the adult group older than 60 years old, the prevalence of pulp necrosis was predominant in the diabetic population. And regarding the gender, females were 1.5 times more likely to have a symptomatic irreversible pulpitis diagnosis than the males. And regarding the pulp necrosis, females were also 0.76 times more likely to have pulp necrosis compared to the males. So patients older than 60 years, pulp sensitivity could be decreased due to their diabetic condition or aging condition. So this lead delay dental treatment and subsequent higher pulp necrosis prevalence. As you can see in this pie chart, that the prevalence of the symptomatic irreversible pattern diabetic patient is much higher in the younger population, which is younger than 40. And when the population was older than 50 or 60, so the prevalence of pulp necrosis was increased. So this study is a retrospective study, should be interpreted with caution, and also may provide some information that may reduce the number of misdiagnoses of disease and change the choice of a treatment for diabetic patient with pulpal disease. Thank you.